Welcome to the 2012 CPHA Annual Conference here in Edmonton, Canada. I'm Amy Rogers with Global Health TV. This year's conference is focused on public health in Canada, maintaining and sustaining a healthy environment. Here's a look at Wednesday morning's session where delegates heard from several speakers.
We're confronting an avalanche of social and economic problems. So thinking about solutions that really work is a way to go. On October 12th of last year, we were very lucky to have our first grandchild be born, and we were thrilled. And it so happened that the UCLA newspaper and all the major university newspapers in the country had this ad, "Reality Sucks," brought to us by our good friends at General Motors, who were telling us that we should stop pedaling and start driving. And you see the picture of the pretty girl smirking at the guy with the bike. Well, this caused an avalanche of response from young people complaining, but one of my students in class said, "Oh, Dr. J, she's not smirking at him, she's flirting with him because she doesn't want to be with the chubby guy driving the car." But this solution that if we build for the needs of cars, we're building for the needs of people, is at a very profound level. And if you look at departments of transportation, they tend to measure how many vehicles move through an area rather than how many people move through an area. In my country, your levels are about half of ours, but in my country we've seen a four-fold increase in the consumption of antidepressants over the last 20 years. People in the prime of life taking antidepressants. If you ask the average person in LA and some of our major cities, what's the hardest part of your day, they inevitably say, getting to work. And probably here it isn't so difficult, but I imagine in Toronto it's quite the challenge. If you were alive when Disneyland was opened, the 405 freeway through Los Angeles had 3 cars on it. At this point, we're running, it basically has stopped most of the day, most of the country. So the quality of life is really deteriorated. Our marriage with cars has brought about lots of problems. Leading cause of death, ages 3 to 34 in my country, is car crashes, and I suspect it's about the same in this country. The traffic engineers and the car engineers brag that, oh, it's getting better, but partly absolute numbers of deaths don't go down because people are driving more and more.
Many of us here who are, of a certain age, I guess, probably remember a Canada before McDonald's, right? Do you remember that? I remember the first McDonald's that came to the community I lived in, and it was the subject of a great deal of curiosity. But, I mean, if you look at what's happened in those, few intervening decades, kind of the proliferation on the landscape and the availability of that kind of different food. But, there are a lot of other aspects about food as well, and I guess you can also argue it's the best of times, because I remember, 50 years ago, what could you get in the way of fresh produce in a supermarket? Certainly in the part of Canada that I lived in, you could have potatoes, turnips, carrots, cabbage. That was about it. How much stuff was grown locally? Well, not a heck of a lot, and you didn't get a lot of choice in terms of imported foods.
If you're actually trying something new, we really need to evaluate it. There's so many programs that are put in place without evaluation, and without evaluation, we really are never going to know what works and what doesn't work. So that's really my plea. To do that, we need to look at cost effectiveness. And usually the excuse I get when I raise this issue is, well, we barely have enough money to put the program in place. How are we actually going to assess its effectiveness? Or we ran out of money at the end, sorry, we couldn't do the assessment. We need to think about the costs of doing something that's ineffective. And we do that all the time. And afterwards we say, sorry, we just wasted a lot of money and a lot of will and a lot of action. So that's my plea for actually doing the monitoring, doing the assessment.